to discuss about lacerations, what are the learning outcomes, to define a laceration, to learn about the morphology and its types, and also to think about medico-legal important aspects. Learning about definition of lacerations. Lacerations are tears, just a minute, lacerations are tears of full thickness splitting of skin. Now in case of abrasions, we learned that involvement is only confined to the superficial layers. Here actually the full thickness of the skin, mucous membrane, muscle or internal organs produced by the application of blunt force trauma and then with the pressure it stresses beyond their limits of elasticity causing laceration. So this is the basic idea of laceration. Now based on this image taken from the Bernard Knight, now you can see here in case of abrasion it's only the superficial layers of the skin had been involved, but when it comes to contusion, you know, no involvement of the skin at all. So this is intradermal contusions as we have learned by now, and when it causes deeper contusions, now you can see here the subcutaneous layer has also been involved. When it comes to laceration, what has happened now, the full thickness of the skin had definitely involved, and sometimes it can reach up to deeper organs, tissues as well. These two examples will explain most of the features of lacerations. You can see irregular margins, uneven base as well. Moving on to this image, what do you see here? Please have a closer look there. You can see very nice irregular margins, and also please have a look inside the injury where you see tissue strands running across the injury. That means tissue bridging that are not separated with the blunt force trauma. This is very characteristic of lacerations. Lacerations are characterized by irregular margins with torn ends, as we have described, tearing rather than clean slicing. In the skin, usually the full thickness is involved, the flow is uneven, often has hair and other foreign matter like paint, chips, glass pieces, sand, etc. because of the place involved, and also it bleeds less compared to cuts. I will explain like this. Now in case of cut, you get a very clean cut where you don't get the natural sealing, but in case of a laceration, you get the crushing effect with the blunt force trauma, and there is a tendency to natural sealing off because of the crushing effect, and also it has a width, length and a depth as well. In lacerations, you can see tissue strands as tissue bridging in the forms of vessels, nerves and facial bands. Age estimation is difficult, actually not reliable at all. It's not a good indicator because of the reasons that there may be a lot of inflammatory response, reepithelialization, and finally it causes a permanent scar formation, as you can understand. And there are certain things that we have to understand. Now imagine bodily areas where you get skin with underlying bone and underlying fat tissue. Now if you get a blunt force trauma, because of the bony support here, such areas are easily lacerated. Example, shin, forehead, maxillary area. If you get fat tissues or soft tissues underneath of the skin, such areas are less likely to get lacerations. Examples, abdomen and buttocks. So however, what is the important medico-legal issue? Without any injuries over the abdomen or buttock, there may be severe underlying injuries because of the transmitted force. You have to understand it, and there may be crushed hair bulbs as well. Now here again a few examples that you can see. So you can see characteristic features, right? So uneven base, uneven edges, and also you tend to name this as a split laceration. Here you get a very nice flat bone underneath. So you get very easily laceration here. And because of this underlying bond, again there is another thing that I have to emphasize. When you get scalp lacerations, it is very difficult to differentiate with the cut injury because of the easy splitting of the skin. You have to remember that. And also moving on to this area. So this is a sutured injury, but you can see very nice surrounding abrasions. Now, if you are asked to differentiate whether this injury is a cut or a laceration, now especially on the scalp, now I have emphasized enough. Now lacerations on the scalp is difficult to differentiate from a cut injury because of the mechanism that we have explained earlier. However, in this case, you have to have a look about the surrounding features. There may be contusions. Cut injury you get with a clear sharp force where you don't get surrounding lacerations or surrounding contusions. But here, because of the blunt force, you can get surrounding abrasions and also surrounding contusions as well. Again, you can see here internal organ laceration. So you can see very nice liver laceration due to blunt force trauma following a following a road traffic accident. Now moving on to this area, you get here inner aspect of right elbow, you can see lot of foreign body sands, right? So irregular margin. So this is a typical laceration with uneven base, uneven things, and also along with foreign bodies as well. Classification of lacerations actually based on the causation. A split laceration comprising of skin in between two hard surfaces, example forehead, shin, we have described it. With that, splitting happens with regular margins with minimal marginal bruising. As I have explained you earlier, it is similar to a cut or an incision. So examination under hand lengths of the injury, that means the base, margins and hair bulbs. Usually in laceration you get hair bulbs as crushed, but in cuts you get cut hairs and cut hair bulbs. Torn laceration. A projecting surface is dragging along the body, causing laceration. Example, road traffic accident, machinery injuries. Stretch lacerations, undue stretching of a skin, and degloving and avulsions. Now here there are typical words that you have to know. Degloving and avulsions usually occur with high energy application. In case of degloving, as you can understand, skin is going to get separated as a degloving action, all right, and removing a stocking like. So here you have to get a rotatory kind of movement with sudden force, ripping off the underlying tissues along with the rotatory force. And avulsion means the separation of a part of tissue will occur. A degloving injury is a specific severe type of avulsion. Now you can understand, right? So degloving, avulsion, basically more or less the difference is the severity. However, you should not get into much detail. However, degloving is very specific for runover injury. You have to know about that, and also with rotatory kind of machinery injuries. You have to know about that part, right? So definitely. Here, an extensive portion of skin and subcutaneous tissue is ripped off the underlying fascia, muscle or bone, similar to removing a glove. An avulsion, tearing away a piece of tissue. And degloving occurs sometimes internal organs as well. Two images taken from the internet. Here you can see avulsed part as well, and also a degloving like injury. Crush lacerations. With crushing injuries, crushing force, and there are atypical kind of lacerations. Actually the mechanism is not blunt as such, but we tend to categorize such injuries as Lacerations, perforated lacerations in firearm injuries, blast lacerations due to expanding gases, and cut lacerations where you get cut lacerations, right? So cut and lacerations are totally opposite terms, but whenever you get an injury with an instrument or tool with blunt and sharp features, example, a mammoth, right? So in this case we tend to name it as cut lacerations, but highly subjective. Here, two entry wounds due to firearms, right? So perforated laceration, you can see here very nice perforations. Pattern lacerations may predict the causative weapon by looking at the laceration. If you don't know the causative weapon, by having a look of the injury itself, you can think or predict about the causative weapon. What are the examples? Now here you can see a stellate kind of laceration, right? So causative weapon, characteristically there may be lots of exceptions, hammer. And also with the hammer you can get crescentic type lacerations as well. With the pole-like instrument you can get splitting-like or elongated kind of lacerations. So the importance is you can predict about the causative weapon. It's only a guessing again. Moving on to the medico-legal importance. Unusual to self-infliction because it's very painful. And categorization of hurt on the face is grievous because of the formation of permanent scar. And dating is very difficult, unlikely. And however, if you can see a mature scar or the completion of the scar formation, we can vaguely tell it is in between more than maybe 5 to 6 months ago only the injury had occurred like. And postmortem injury or postmortem laceration could occur, but remember, there are no vital reactions. That means no inflammation, no edema, no bleeding, nothing. Vital reaction means bleeding. It's a collection of things: bleeding, hemorrhage, and then inflammation, pus formation, swelling, right? So in case of postmortem laceration, yes, can happen, but you can't see any vital reaction. Right, so moving on to a few practice MCQ. Lacerations are caused by sharp force trauma. It is incorrect, right? So by definition, it is with a blunt force trauma. Tissue bridging is a characteristic feature. Yes, correct. When compared to cuts, lacerations bleed more. It's incorrect because of the tissue crushing effect and natural sealing, right? The other way around is true. Lacerations are seen only externally. We can see internally as well. With the force, there may be enough lacerations. Scalp lacerations may mimic cut injuries, definitely true. The mechanism of causation of degloving is the separation of the skin and subcutaneous tissues due to shearing force, definitely correct. Or rotatory force, yes, correct. Lacerations provide an accurate estimation of timing. It's definitely incorrect because of healing, inflammation and everything. Yes, incorrect. Firearm injuries are categorized as perforated lacerations. Yes, it's correct. The mechanism of degloving injuries, severe machinery or rotatory force application. Yes, it's correct. Now you have to know degloving injuries usually can be seen with run-over injuries. Lacerations leave scar upon healing, definitely correct. Lacerations are typically caused by chemicals. No, it is with blunt force trauma. In decomposed bodies, interpretation of lacerations become difficult because we identify a laceration with irregular scars and uneven base and tissue bridging, etc. However, with decomposition, we can't see any of the features, so this is correct. Lacerations may show surrounding contusions or abrasions. Because of the blunt force trauma, you can see it. However, in cut injury, usually you don't get any contusion or surrounding abrasion. Split lacerations occur when skin is crushed between bone and a blunt object. Yes, correct. Pattern lacerations may suggest the type of weapon used. Yes. So what are the pattern lacerations? You get stellate shaped or crescent shaped one with hammer blow, and also you can get split or linear like laceration with a rod like instrument. Lacerations are easily occurred over bone areas, yes, because of the underlying support. The flow of a laceration is uneven, correct. Lacerations may be associated with underlying fractures, yes, definitely, that obvious fact. Hair bulbs are crushed in lacerations, yes, it's crushed. In case of cut, it is cut. Now imagine now with a sharp force trauma, what will happen to the underlying bone? You get a cut, right? So cut also bone cut also a fracture, because by definition the discontinuity of a bone is termed simply as a fracture. So as a result, with sharp force trauma you get cutting of the bone, but with blunt force trauma you get usual fractures, right? The margins of lacerations are usually irregular and abraded, correct. Surrounding contusions are likely to see, yes, definitely. But whereas to this, if it's a cut injury, so this is how that we are going to differentiate cuts and lacerations. We used to see each and every feature, whether the hair bulbs are crushed or hairs are cut or not, and how about the margins, how about the base, how about the underlying bones. So this is how we opine about the causative weapon. Nobody is coming to and come and tell us that, oh, this murder had been done with sharp force trauma, right? So however, we have to appreciate the features of the injuries, and then we have to reconstruct the incident and also to opine about the weapon. Now you can understand the medico-legal importance, right? Scar formation is a characteristic feature, it's correct. It is difficult to get abdominal lacerations, yes, it's again correct, because of the fat and lax tissues. It's difficult to get lacerations over the soft tissues such as buttocks and also over the abdomen. And lacerations on a putrefied dead body are identified by appreciating the nature of the underlying fracture, as I have explained earlier, right? The underlying bone should cut with the cut injury, right? So now superficial injury had been destroyed with the effects of putrefaction, but by appreciating the underlying bones and other features, we can think about or we can opine about the causative weapon. Crushed hair bulbs are helpful to differentiate cuts and lacerations. Yes, definitely. Thank you then.